Mhm. I'm wondering about the psychotherapy side of the equation. You've come out pretty strongly for appropriate medications as being maybe the go-to, at least initially, the go-to solution or the beginning of the go-to solution.
Right.
What about the talk therapy part of it? What happens there?
So in my book, Owning Bipolar, and in the clinical trainings that I provide, I talk about a three-phase approach to bipolar therapy.
Okay.
And those phases are centered around the medical stabilization of bipolar mood swings. Um, the first phase is that pre-stabilization phase. That's before medications are really not only presented, but effective. And there's a period of time to make that happen, and it's different case by case. But the pre-stabilization phase is, and I think we've talked about it already, is marked by denial. Um, uh, that's, I think, really the main feature. It's marked by the consequences of untreated bipolar disorder, whether it's financial problems, health problems, relationship issues. All of these things are a part of the bipolar crisis
And
that
so they're
bipolar
kind
is
of they,
affecting.
they kind of need to own up to it, using your word owning again. They kind of need to own up to, I've got this problem in my life.
Right, and that happens in different at different levels through the process.
Sure.
But indeed, that's where the education and assessment part comes, and the conversation begins by separating the perceived beneficial aspects with ones that are, I guess, harder to deny, that have that negative impact in that person's life. So we're less focused on telling people you have bipolar disorder, because what does that mean to them anyway? But we can say, yeah, there are moments when you have experiences that are very exciting, very thrilling. You're experiencing a high, but there's another side to that. Let's talk about that other side, and let's talk about the symptoms that and the parts of what you're going through that you don't like, and enter that conversation and help people to identify what their fears and concerns are about all of those things together, and really begin to have a conversation about that, an assessment process that really nails down a bipolar disorder diagnosis, if indeed that's what's going on, and then begin a medication conversation. And as it gets closer, I think, to answering your question, we as therapists, I think, too often try to scuttle that part of the discussion to the physician because maybe we don't feel qualified to talk about that. I think all therapists, certainly those that are going to assess and treat people that have bipolar or any other kind of mood disorder or anxiety disorder, OCD, etc., that would benefit from medication, to have at least some understanding and some knowledge about what those medications are, because we as therapists talk about it more very often than even the doctors do, by virtue of the fact that they tend to have more contact with us. And I think doctors appreciate that more and more anyway. It's not a turf thing like it used to be.
Mhm.
I think doctors and therapists collaborate more in this generation, and that's great to see. So we're going to enter a conversation about medication and help to, as we talked about a little bit earlier, allay some of the fears, get the facts out, what to expect, and not to create a rosy picture either. Moving from pre-stabilization to stabilization, the next and second phase, can be really rough for people. Sometimes the medication process goes very well. Yay, we all are excited about that. But we have to expect that there's going to be some experimentation, some trial, and it may take more than one medication. It may take 2 or 3, at least in the beginning, to really address the symptoms based on their severity and so forth. And during that time, we're also helping family members, in a sense, to stabilize, not medically, but psychologically, because of everything that they've been through with bipolar disorder. We can't leave the family members out. So often people around the person with bipolar disorder, will say that they feel like, okay, my loved one is getting treatment and getting help, but what about me? What about what I've gone through?
Mm.
And it's
Yeah.
not just like, hey, she's on medication now, so you should be fine, and we're all going to be fine. Well, we know that psychological pain and the trauma that we went through doesn't just go away. it needs to be understood and addressed in that context as well. And ultimately, it helps everybody going forward. And as the individual stabilizes, the family support system does as well. We move into the third phase, which is hopefully very long, and that's the post-stabilization phase. And that's where we move from treating symptoms in the beginning by breaking them down to lacing them together into what we call bipolar disorder, but then treating the whole person, not just the bipolar disorder, but all of their personal self-esteem, identity issues, family dysfunctional issues that may have either been created by bipolar disorder or by other factors, and help that person and the support system around that person to have a communication together that's more effective. You know, one of the things, Dave, that people often say when they're in that post-stabilization phase is that I don't want my loved one to tell me that you're really upset. Are you off your medication? You know, that they don't want everything to be looked at as bipolar disorder. They want to be looked at for who they are, and they're discovering that through that process themselves.
Mm-hmm.
But they often desire that the family, the loved ones, develop a communication by which we can talk about bipolar if necessary, but we can also talk about what it is to really experience real feelings that have real causal connections with our immediate circumstances. So there's so much to talk about in therapy going forward from that perspective.